So every patient has some degree of pain after a total knee replacement. It's a total knee replacement. There's going to be soreness, there's going to be stiffness, there's swelling, there's bruising, there's an incision, there's inflammation. And so we expect that in all of our patients. The key is to make that pain predictable and manageable. And that's one thing we've gotten very good at, particularly in the past 10 to 15 years. We've had a lot of really good data on how to control pain better after total knee replacements. A lot of this starts before the case has even begun. There's a preoperative cocktail that we typically give to patients, including steroids, pain medications, anti-inflammatories, sometimes even nerve medications that help to reduce the potential for postoperative pain. It continues during the surgery. We have medications that we can give you to help you bleed less, so there's less inflammation and swelling after the surgery is over. We do an intraoperative cocktail, or joint juice we call, when we inject around the subcuticular tissues within the periosteum, within the muscle planes, to give you a local bit of pain control, almost a local block that helps to reduce pain after surgery. And then finally, in the postoperative period, initial early motion helps to get the patient rehabbing faster, and adequate pain control when we use a multimodal approach. So it's not just stacking the patient up with narcotic pain medications, but giving them anti-inflammatory medications, steroids. There's a variety of things we can give you after surgery to help reduce the narcotic need and get you through the postoperative recovery with pain that is predictable and manageable.